So I'm thrilled that today Nancy Pelosi came out and said that we need to consider universal basic income. Dozens of members of Congress are already now saying we need $2,000 a month for everyone during this time. What I've been saying to people in Madison is that this crisis has in many ways accelerated the rate of change, where we've gone through 10 years of change in the equivalent of 10 weeks or less. And so obviously I thought universal basic income was a good idea even in the absence of this crisis, but it's more urgent than ever. The universe of people that are not getting it, unfortunately, in the millions of, like tens of millions, because a lot of people don't file tax returns, or they don't have auto pay, or there's some issue. So to me, I would be reversing the scales, where instead of like the vast majority going to big businesses, I would say the vast majority should be going to people. And I would make it as universal as possible, even beyond certainly any level of income, but even whether or not you filed a tax return. If we can find you, we should be giving you enough money to get by. We're in a crisis. And one of the things I've said to folks is, like, when the house is on fire, you don't worry about the amount of water you're using to put it out. So we've got a $21 trillion fire going on, and you just need to do anything you can to put it out. So some of the things I think we should be doing, I think we should just be like sending money to every nonprofit that's doing pretty much anything under the sun. Because like nonprofits, you know, their support levels are plummeting. All of them canceled their fundraisers. They're cutting people. Do you really want nonprofits like firing their people now of all times? So we should be taking any organization that's doing anything positive and just like put money into their hands so they're not firing people. Same is definitely true of states, hospitals. Like, you have to push on the things you can push. And one of the reasons why I've always been so passionate about universal basic income is it's one of the few things you can actually do very quickly. You know who's not getting the vital supplies? Louisiana, Mississippi, places that are poor. And guess what? That's where the public health threat from the coronavirus is highest, because you have low levels of healthcare infrastructure and very high levels of pre-existing conditions.